Hello, everyone. Welcome to the Dr. Sophia Podcast. I'm an ObGyn practicing for over 15 years in my native New York City. And I love to help women learn about their bodies, empower them, and embrace themselves. On this podcast, we will talk openly and with heart about all things affecting women, from pregnancy, menopause, periods, sexual health, fertility, and so much more. Disclaimer: this is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Hello, everyone. It's me, Dr. Sophia, and we are here with Touseef Mirza. And I thought you guys would like to know this little fun fact. Touseef is not only one of my very good friends, but she's also my patient.
I am. We've known each other more as friends.
Yes, absolutely.
We've known each other as good friends for much longer. But then there was a point I was just like, why aren't you my ObGyn? Like, you know everything else about me. So that's how that happened. One of the things that's come up is that I am in the age right now, I'm 51, and I'm in the process right now of figuring out if I want to consider HRT, which is hormone replacement treatment, because I'm almost done with menopause. I'm almost at the full year without any period. And since this podcast is all about sharing and embracing our bodies and ourselves, I thought that it would be good to, instead of having a one-on-one with Dr. Sophia and asking her all the questions that I have on HRT, is actually to just come here and share it with all of you as well. So this is literally what would be happening like in her office. And I have all these questions. So, welcome to my world right now. So this is
welcome to my world right now.
So before we begin, let me just ask you if I would come into your office and I would say, I think I'm almost menopausal and I hear about HRT all the time. What is it exactly?
So I think let's just take it back just a little bit. When we think about menopause is going through consecutive 12 months of no period and is usually attached to a lot of other symptoms that may be happening at the same time. And those symptoms can start way before you actually go through those 12 months of no period, and where we then consider you as being menopausal. So some of the symptoms include hot flashes, night sweats. We've talked about this. I know you ladies and everyone else out there have all listened to our Menopause 101 podcast. But just as a quick review, some of the symptoms include hot flashes, insomnia, night sweats, energy changes, mood changes, weight gain, mental fog, just to name a few. And so oftentimes women will come to me because they are concerned with some of those symptoms that they're experiencing and how, if anything, that they can be doing in order to help them through those symptoms. And that's where the concept of HRT, or hormone replacement therapy, comes in. And just to be clear, it doesn't mean that everyone needs hormone replacement therapy and that the only way to mitigate some of the symptoms that women experience with going through the change called menopause is only possible through hormone replacement. Absolutely not. There are diet changes, there's exercise, there's meditation. There's so many other ways in which women can address some of those issues successfully, but it's individualized.
Thank you for that recap. So going back to me now, just to give a little bit of a background in terms of where I'm at, in terms of health-wise and everything. So like I said, I'm 51. I would say I'm not a person that has had too many hot flashes in my past, even in perimenopause, which is like before menopause, when you start to change your hormone levels already. I do have a little brain fog here and there. And Like 4 or 5 months ago, I was feeling really tired and lethargic, but now I'm doing more exercise and I'm just feeling much more alert and not as drained anymore. So that's been going well. I've been able to mitigate certain aspects of that. And I have gained a little bit of weight, not super substantial, but a little bit of weight. And even if I'm eating well and I'm working out, that's not really moving a lot. I think also it'd be good to talk a little bit about my medical past. I'm a healthy person. I haven't had any kids, like just from a pregnancy standpoint. And I haven't had any cancers. So I'm pretty a healthy, knock on wood, I'm a pretty healthy gal. One thing I think is important to note, just from a medical history perspective from my family, just two things is my father had Alzheimer's. So there is a disease of cognitive decline. And then my mom does have some heart condition. So that's pretty much the whole like medical aspects of things. Considering all these different factors, like, do you think that HRT is something that would be good for me to consider?
So before we even talk about HRT, I really need to know a little bit more about what other symptoms you're experiencing. So you did say things like brain fog. You do feel like you've had a little bit of that, and that you're not really experiencing bothersome hot flashes. You may get them, but it's certainly not something that's top of mind as being something that's bothering you. And it doesn't sound like you've really mentioned any of the other symptoms. I mean, maybe a little bit of weight gain, and then the energy you've been able to kind of, or the fatigue maybe, which may be related definitely to menopause or being perimenopausal.
Uh-huh.
But it seems like you're doing a good job of handling it in terms of exercise. So all of that is great. Because you're at the ideal age for starting hormone replacement, if it's even something that you're thinking about, then I actually would consider it from a standpoint of some of the benefits
Hello,
of
everyone,
starting hormone
and
replacement.
welcome to the Dr. Sophia
Now, like I said, it's not
ObGyn
for everyone.
podcast.
And it's just the sheer fact that you're thinking about it is what makes me think about it. So from a cognitive standpoint, as well as a heart disease standpoint,
Further history.
and that's your family history.
That's
but
my family history.
and that's not your personal history. However, hormone replacement does decrease the risks of both cognitive decline as well as heart disease in women. And so if that is a big concern of yours, then it would be something that I would consider. And it's not because we're trying to say, oh, start hormone replacement therapy because this is somehow going to be prophylactic. I don't just start hormone replacement therapy on women as a preventative measure, right? But in someone like you, where you're telling me, hey, these are the things that are happening or has happened in my family as far as family history. And moreover, I am looking to see what else I could be doing to maintain my healthy status. And you do have a few of the symptoms that are associated with menopause. And starting hormone replacement could certainly help with those symptoms. And so I think it's very reasonable to start you on hormone replacement. I think it's very reasonable for you to be on it for a long time.
So what is a long time? Once you start, do you stay on it for the rest of your life? Do you get off it? I guess it depends the goal with HRT, but considering what we're talking about, how would you gauge that?
Considering what we're talking about, I have to tell you, I'm definitely of the school of thought that if you start hormone replacement and it's working well for you, that there's no age, time limit, time frame for which to stop. If you look at medical literature and if you look at the way that most people practice in the sense of hormone replacement, many people will say that you should continue for up to 5 years. And it definitely should be started within the first 10 years of menopause. So I definitely believe that the best time to start hormone replacement is definitely in that perimenopause, early menopause timeframe. However, how long you stay on it, I think women can be on it well into their 80s, even 90s. I have some women whom I know started hormone replacement back in the 80s who are clearly still on it and feel great.
So it's interesting you bring this up. I was asking my mom because she's been on hormone replacement therapy since like 1988.
I'm not surprised.
And for her, it's just like, yeah, that's just what I've been taking all the time. And that's just what it is. But then, then I start to think, why then do we have this bad rap?
Oh, the bad rap.
The bad rap of HRT. And I think I'm also affected by that. This is why I'm like seriously thinking, well, do I really need it? Do I not need it? Are my symptoms grave enough, or is my family history that severe that I have to do it, or is it better not to do it because of the quote unquote bad rap?
So the bad rap for HRT or hormone replacement really came from the Women's Health Initiative, a study that basically showed increased risks of different conditions such as stroke, such as breast cancer with hormone replacement. But those increases were so small, actually. And one of the biggest parts of the study that just was not looked upon as a big deal is the fact that the average age of the women who were in the study and started hormone replacement were 63. So well after the time that most women who are seeking hormone replacement therapy would be. Most women who are seeking to start hormone replacement are in their 40s and 50s. And so at 63, where your average age of menopause is about 51, and these women were 13 years past menopause and only now initiating hormone replacement therapy. And so at that age, they actually already had a lot of the increased risks for all of those diseases in the first place.
Because they're older.
Because they're older.
The risk is higher with age.
Exactly. Mm-hmm. So the risk of breast cancer is higher. The risk of coronary artery disease or heart disease is higher. And so what was interesting is that you actually have a lower risk, for example, of coronary heart disease or heart disease if you start HRT younger. If you start HRT and the early signs of menopause or the early the early time frame of when you're going through menopause. And that's just one thing and as one example.
So I feel like we have it all upside down then. Then everything you're saying is that, it's actually on the up and up versus everything that we've heard is more like, you have to be skeptical about this. So let me ask you this. If I take HRT, what is it actually doing? Because I know my estrogen is going lower because of the phase that I am from a hormonal level in my body. My estrogen is going low. So is the HRT actually replenishing my estrogen levels so the body continues to be in homeostasis? Like, how does that work?
So yes, hormone replacement therapy is the combination of estrogen with a progestin or just estrogen alone, depending on your personal situation. So in your case, it would be that you would be on both estrogen and progesterone or progestin. And the point of it would be to, yes, basically prolong your exposure to estrogen in your body. And why is that? Because estrogen is protective. Estrogen is protective for your bones, your brain, your heart, your breast.
Which was always there.
Which was always there.
That level of estrogen was always there before to do those things.
That is correct. It's the reason why women have a lower cardiovascular risk and their cardiovascular risk does not increase until after menopause. So as an example, so all you've done is prolonged your body's natural way of protecting itself by starting hormone replacement, as well as mitigating some of the really unsightly and frustrating symptoms that come along with menopause.
Such as hot flashes.
Such as the hot flashes, such as the insomnia, such as the fatigue, such as the mood changes, the anxiety, the depression, the paranoia that happens during the menopausal changes.
Let's say you have a certain level of estrogen in your body that's 10. Okay. Let's just say that as my normal level when in my 20s and my 30s. Okay. Then when I hit perimenopause, menopause, my estrogen goes lower. Let's say it goes down to 6. Okay. This is all hypothetical. All right. And then am I going to continue to have lower and lower level of estrogens as I age, or can it stabilize, or it can be either?
No. What happens after menopause is your estrogen levels go to the floor.
Okay. So it keeps going down and down.
It just keeps going down.
Okay. And then hormone replacement therapy enables that estrogen number to go back up.
It goes back up to a baseline that is, we're trying to make it so that those estrogen receptors in your body, the ones that are in your brain, the ones that are in your heart, in your bones, okay, are still getting the effects of the estrogen, the beneficial effects of the estrogen.
All right. So just to break it down, estrogen basically is something that affects all different parts of your body. And that's why we say estrogen receptors.
Yes.
Is that a lot of different parts of our body uses estrogen.
Yes.
In order to function.
Our skin is one of the organs that uses estrogen.
Okay. Then the question is, and by the way, I would have asked all these questions one-on-one. So, because I'm really trying to figure out if it's a good decision for me. The HRT, in terms of the molecule that then goes in my body, how much does it mimic the real estrogen?
That is the whole point. It does.
It does?
It's mimicking your body's natural estrogen. It's mimicking that.
Okay, let me ask you this. Do you ingest a pill? Is it in pill form?
Yes.
Okay. So then when I'm taking that pill, it's full of estrogen.
Yes, it's a pill that has both estrogen and progesterone, and it doesn't always have to be in a pill. It could be in the form of a patch. It could be in the form of a gel. It could be in the, so I don't want you to think about it just in terms of like how you're taking it. I just want you to think of the replacement. The concept is here replacing these hormones. And when we say replacing hormones, it could even be talking about like thyroid hormone. Thyroid hormone also goes down. And thyroid hormone, what's really is a very underutilized hormone. And, when we think about it, because it's the hormone that helps the rest of all of the other hormones work so well. It's kind of happening in the background in terms of what it does for us. Also helps us with mood and our brain function and our metabolism. And, it's the concert of all of these hormones working in your body that all go in a decline as we age.
But HRT doesn't have thyroid.
When we're typically thinking about HRT, yes, we're really mostly talking about estrogen and progestin. But there are other hormones. There's, like I said, thyroid hormone. And in some cases, there may be, replacement even of testosterone in women, And so this is a very individualized conversation. I want women to feel they can embrace the concept. If it's something that they're questioning, that they're going through all of the symptoms that are associated with menopause, having a better understanding of what some of the actual benefits are and some of the risks and who really is a good candidate, and knowing that it's okay to want to be on hormone replacement therapy.
I think one of the things we need to say, even before saying it's okay to be on hormone replacement therapy, it's okay to want to be okay.
Yes, it's
Right?
definitely okay. You should. Why not? If it's something that's your mom, let's just use your mom as an example.
Yes.
As a woman of a certain age at this point,
Yes.
but who has been on hormone replacement therapy for almost 30 years.
Yeah.
Right? Or more, actually. She's been on it for more than 30 years at this point, right?
Yeah.
So it's a part of her vitality.
Mm-hmm.
And so it's a part of like your mom, the benefits that she's reaping from this is lower risk of colorectal cancer, improved cardiovascular health. And even if she has cardiovascular disease, the concept, she's still on hormone replacement.
And the reason for that is because we say HRT, but the reason for that is because she has a level of estrogen in her body that enables her body to function as it's supposed to better than if there was no estrogen.
If she had no estrogen, her body would be functioning. How do I put this? Because I don't want people to take away from this that I'm simply trying to push HRT, because that's not the case, right?
Right.
I don't want to be misunderstood. As a woman of a certain age, she's going to have age-related risks or issues, health issues, potentially. And by her continuing her hormone replacement, she is, in a sense, mitigating some of that.
Mm-hmm.
Now, of course, she's still getting older. So there are still some things that are happening. But if we completely stopped her, she would probably not feel as great as she does.
Mm-hmm.
If I had to use a metaphor, perhaps, of the benefits or the reason why one would be on HRT, I would say, if we have a bouquet of flowers and we put water in a vase and we put, let's say, some flower food. Now, because we've put in the flower food, extended the life, the beauty of that bouquet. So instead of having a bouquet of flowers that's going to be beautiful, let's say, for 3 or 4 days, I now have extended the beauty, the life of that bouquet, let's say, to a week.
Mm-hmm.
And so in those 7 days, let's look at the bouquet of flowers over 7 days. There's the one that had some flower food and the one that didn't. And they're both going to be wilting, but one may wilt a little faster. One may progressively wilt and die eventually. And so the one with the flower food, it still is going to eventually die.
Mm-hmm.
But the wilting process is long, takes a lot longer to get there.
Because they have that extra.
Because they've gotten that little extra.
Right. And that flower food.
And that flower food
yes.
is the same flower food that would have been, let's say, in the soil before we even cut it.
Right.
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 And so let's say menopause or going through menopause is having cut the flowers in the first place. And all you've done by putting in the flower food is as if you've kept it in the soil.
Mm-hmm. So you're recreating that environment.
Exactly.
That it likes to thrive on. And
Exactly. So yes, of course, it's still going to go through the process, the aging process,
mm-hmm.
right? But it's going to go through that process a little bit slower, a little bit more vital.
Would you say that there are, what are certain potential drawbacks aside from, like the risks that we talk about depending on my health situation, but just in general, like smaller types of symptoms? Like, does it give you headaches or does it give you any stomach issues? Like, do you know if it has a tendency to do that?
So again, when we're dealing with hormones and hormone changes, or adding and subtracting and that kind of thing. We have to get to a balance. We have to get to a point where it's good for you. And so in that process, in that time frame, you may have things like nausea, you may have things like headache, as you say, you may experience, those are small like side effects that may or may not happen and may only happen for a small amount of time. A little bit of potentially water weight. But again, these are things that over time go away. And so as your more common, I would say, side effects, so to speak, when we're talking about risks, specifically like contraindications and that kind of thing, I would say that any abnormal bleeding, then we would want to investigate first why someone's having abnormal bleeding before starting them, let's say, on a hormone.
So you're talking about like
I'm talking
period?
about like bleeding, not a period. That's exactly my point, that we're talking about bleeding that's happening. If you're menopausal, you should not be bleeding.
Right.
Okay. Once you've hit menopause, then all bleeding stops. So if you have bleeding after menopause, then that should be investigated before starting any type of hormone replacement.
Okay.
For example.
Does it happen that once a person starts to decrease the estrogen level when they're around my age, that eventually it starts going back up?
No.
Okay. I'm just asking. So basically, if
it does, then something's wrong.
And something's wrong.
Yeah. If you are a menopausal woman and all of a sudden you start to have high levels of estrogen again, you might be feeling good, but you may also have some really serious medical issue happening, such as a estrogen secreting tumor, and so that's a whole different conversation, but the bottom line is no, once your estrogen is gone, it's gone for good.
So then when we say that, because I've heard that, if you're having certain symptoms of perimenopause, menopause, if you do certain things that we talked about, like exercise and proper diet and you're sleeping, that it does help. So how does it help?
So it helps because let's talk about exercise, for example.
Yes.
And let's talk about some of the other symptoms of menopause. So exercise generates dopamine. Dopamine helps with mood. Dopamine helps with sleep. Dopamine helps. It just overall helps with so many other things. And the exercise itself is going to help you in terms of cardiac or, the benefits that it has on your body, on your heart, etc., on your bones, on your muscles, and that kind of a thing. Now, exercise is not bringing up your estrogen. Those are two different things. But exercise has the overall benefit on your health, and it helps with certain symptoms of menopause that are not only going to get better just because of estrogen, for example. That's what I mean when I say that there are other ways, if we're only thinking about symptoms, that there are some ways in which to mitigate some of those symptoms. And exercise doesn't help for everybody. Some women, they can exercise 5 hours a day and they are still suffering with hot flashes. And hot flashes, we know, comes from the jagged up and down part of perimenopause in terms of estrogen. And then, of course, the complete decline of estrogen.
I think this is so important what we're saying, because I think by understanding really how estrogen works, and when we say, yes, if you exercise, if you sleep, because I think sometimes if a woman feels like she's doing all of that and still she's having a lot of menopausal symptoms, she might say, well, what am I doing wrong? Or maybe I'm not doing it right. Or maybe I'm not doing it enough. But actually, since that is actually not affecting the actual estrogen level,
that is correct,
that it might be two completely different things that we're talking about. So I think that is a place where there's confusion, because we link sometimes exercise and sleep with menopause. And so we think that we can control it. in certain conditions, it can help, like you're explaining. But in certain conditions, for certain people, it doesn't matter how much you do it.
That's right. You can exercise until you're blue in the face and still have 10 hot flashes a day, which is disruptive to your day, or have night sweats or have brain fog. Granted, exercise also helps with the brain function, but you may still be having bothersome symptoms that are menopausal symptoms that will really only get better once you start hormone replacement.
So let's say that I start HRT and then I'm feeling better, but I want to see maybe, I don't know, after 6 months or a year, I'm just like, I just want to see if I would stop, how my body would be.
Women do that all the time.
They do?
Yeah. As a matter of fact, I would say that probably most women stop taking HRT after, a few years.
Okay.
Just because they're like, do I really still need this? And sometimes they don't, because the bigger symptoms that they were taking it for have really diminished. And they're basically at a baseline that they feel comfortable with.
But you can only know that once you stop it.
A lot of times, though, there are women who do stop and their symptoms return and they're like, oh, no, I'm not doing that.
I mean, I will be honest, like there was a point where I was feeling lethargic and really tired. And it lasted for a while, so much so to the point that when I woke up one day and I was feeling fine, I had forgotten, oh yeah, this is how I used to feel. Like, you just get so used to it. And I think as women also, when we had our periods, we're just like, well, I guess that's just the pain it is. So we'll just deal with it.
Just push through.
We just push through. And I think it's, this is even for me at 51, like, I'm trying to not make it a default, but actually see it and try to address it. And not just think of it, oh, well, that's just my body, so I'll just go and do it. This actually goes back a little bit to our previous episode of to endure or not endure. So if you haven't listened to that, I mean, we literally talk all about this in terms of how we
push through as women.
Yes, and why we do that. But I think we just don't have enough conversations about menopause and HRT in terms of really understanding all these nuances. And once you start looking at these nuances, I'm not saying right now that I'm 100% going HRT, but I have a much better understanding and I'm going to think about it some more. And I think we could continue and talk about, I'm totally fine talking about my journey and seeing where that goes, regardless of whether I move forward with it or not.
Well, I hope what you've really gotten out of this is that you should have some grace with yourself. And if you feel like you would like to start HRT for whatever reason, in terms of symptoms, in terms of just vitality and longevity, I think that is completely reasonable. And at the same time, if you decided not to start HRT, that is equally as purposeful for you. And so I love the fact that we've gone through this discussion, because the point of this is just so that you feel like you've gotten the information and that you feel like this is a decision that we can come to together. And you can continue to have questions and we can continue to talk about it.
Awesome. Thank you so much for all of your just openness in going all different directions. Because God knows, I know I always have tons of questions. So thank you for that.
You're very, very welcome. And as always, thank you for being here and joining me on the Dr. Sophia podcast.
Bye.
Bye. This is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Until next time, embrace your body, embrace yourself.